There you go.
Okay, it's 6:30, so we'll start the meeting of the Hayward Health and Human Services Committee. Do we have a roll call
Dale Schluter,
here?
Kay Wilson,
Here.
Marshall Savitsky, Michael Maestri,
Here.
Chris Rusk, Bill Trepanier, Don Pettit,
Here.
Cheryl Pearson, Sabrina Dunlap. I saw that she was here. She's online.
Okay, let's stand for the Pledge of Allegiance.
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay,
This meeting has been noticed to the public and news media as required by section 19.84 of the Wisconsin statutes.
okay, are we going to leave meeting agenda on these agenda forms, or do we need to have them on there even?
You don't need any motion. It just is, and that it's a placeholder in case people want to switch things up.
Okay. So moving right along, public comments. Do we have anybody who wishes to talk to the board? Okay. Consider approval of minutes from our previous meeting.
I'll make that motion.
I'll second.
Thank you. We have a motion and a second. Any discussion? Everybody in favor say aye.
Aye.
The motion passed. Yeah, I lost.
Okay, at this point, I don't believe that we have a LCO liaison named. Have you heard
He's
anything?
named Bill Trepanier,
Oh, is.
and he did receive the
I did
packet.
see the
Yep.
name on here. Okay, perfect.
Okay,
Hey. And but Bill is not online? Okay,
go ahead. Were you going to have him introduce himself?
he's not online. So Bill Trepanier has been appointed to be our LCO liaison. I have not had a chance to talk with him, so,
Okay.
and we don't see him online.
Okay.
Lynn, do you have any updates on the Senior Resource Center that we need to share?
Nothing further from us.
Okay.
Okay, I'm lost.
Okay, we were on committee reports, LCO liaison and Senior Resource Center, and now we're on administration.
Thank you.
Okay. Administrative report. I've got a PowerPoint. I just need to move so I can see where everybody's at. Okay, first thing I'd like to announce is our leadership team is complete. Sarah Anzauskis, who is here, you want to stand for us? She was our YJ lead, and she has accepted the position of Children, Youth, and Family Services Supervisor. So welcome, Sarah.
Welcome.
Yes, welcome.
Okay, and the next thing is there's a number of observances for November. The National Rural Health Day is on November 16th. So that's something that we'll be connecting with our rural partners and celebrating all the work that is done in our community. Public Health Thank You Day falls on the Monday before Thanksgiving every year. And so we'll be recognizing our public health professionals on that Monday. It's also National Caregivers Month, and there is from the American Presidency Project. I'd just like to read the proclamation. During National Family Caregivers Month, we recognize the love and sacrifice of more than 50 million Americans, providing crucial care and medical assistance to parents, children, siblings, and other loved ones, ensuring their health and dignity. Today, far too many Americans find themselves sandwiched between the enormous tasks of supporting aging parents, raising young children, and earning a living. Others bear the responsibility of caring for loved ones with a disability or looking after wounded, ill, or injured service members and veterans who have sacrificed so much for all of us. The truth is, at some point in our lives, each of us will likely need to be a family caregiver, but the burden falls especially hard on those who cannot afford support. Women, people of color, and immigrants shoulder a disproportionate share of the obligation, sometimes forced to leave good jobs to instead provide care. Their work is profound service to their families and our nation, but they are too often unseen, undervalued, and unpaid. And I'm just thinking that it's really appropriate now, especially in a time that it's really hard to find paid caregivers, and many people are having to stay home and care for their loved ones. In addition, it is National Alzheimer's Awareness Month, and that color is teal. Oops, I don't know if I can move that. Nope. And teal is chosen for Alzheimer's Foundation because it is the color that studies show is a calming color. So when you see that, or if you're doing any planning on presentations or anything out in the community, consider using teal. I'm sorry, Dawn. Yes.
It's okay. We went through the Senior Resource Center. There was no report filed.
No, there is no report filed.
So there was no update for this month.
Nothing new for this month. Did you want to go back to that?
No, I just wanted to see if there had been a report, and when I looked through the documentation, I didn't see anything.
Okay.
All right, thanks.
You're welcome. The other update that I wanted to share is it's also Dementia Care Specialist Week. It's going to be November 13th through the 17th. It's really significant that we are trying to improve dementia awareness in our communities and having dementia-friendly businesses, and something that we've been working on pretty hard this year. Joni has been working on this. Over 26% of Sawyer County's population is 65 and older, and it's estimated by 2040 that will be up to 33%. So definitely an area that we want to continue to focus on as we move forward. And the other highlight that we have is the Department of Children and Families. The secretary, Emily Amundsen, is going to be coming to visit us. She'll be spending an hour and a half with our Sawyer County Children, Youth, and Family Services Department and learning about what we've done to regrow the department, as well as some of the obstacles we face in this rural community in finding placement for our youth.
Mm-hmm.
So excited about that. And then after that, we'll be going to Northwest Connections and connecting with them over there with the secretary as well. Okay, and then any questions before I move on to something that we need to vote on? Seeing none, we are going to be scheduling our next all-staff meeting, and we are proposing that we do that on January 24th, 2024. This is something that we'll need a motion and a vote on from the board. We'd like to be able to close the department down at 11:30 a.m. and we'll be closed till the end of business at 4. So this will be just like our last all-staff meeting. But we'll be doing that January 24th if approved.
Okay, do we need to approve
I
this?
believe we need to, because we will be actually not available to the public.
Okay, well, I was gonna I thought last time when we did this, we approved all four.
We had to approve this specific date.
Okay, thank you.
Yes.
Go ahead.
I'll make a motion to approve the all-staff meeting day for January 24th, 2024. From 11:30 to 4.
Okay, we have a motion and a second. Is there any further discussion? Okay, then everybody in favor say aye.
Aye.
Anybody opposed? Motion passed. Please continue.
Okay, that is the end of the administration report. However, we do have one more thing under administration, and that is the fee schedule that we need to review and approve. I am putting it up on the screen just because I know that for some people, it might not have printed out okay. When I printed it out, it didn't look real clear. So hopefully as you're going through it, you can see that. In behavioral health services, one thing that we're adding, and actually it should be under in general, will be drug test fees that we would be doing for anywhere in the departments that would be doing drug testing, and we'd be adding a $20 fee for drug testing. Public health, we are eliminating some of the fees that we have on here and increasing the Sharps container disposal fee. Reproductive health costs will stay the same. Water tests will be increasing, generally $5 to $10 for each particular test. We have some different tests that are available and looking at, so that's where we see some of those changes in the water tests.
Excuse me, what, how much does it test to?
Okay, so we will be, for the water test for just the general coliform bacteria will be
Yeah.
30.
Oh, okay,
Nitrates will be 50. We're going to add a single metal charge that way if somebody just wants to retest for a specific metal, they're able to do that. A basic homeowners package, a metals package, and then comprehensive owners package, which includes both the metals and the general package.
Julia, have you compared these prices with private businesses that, like if you go to Butterfield, they have that service as well? And how does that compare?
I'm gonna, Julie, you wanna come up just so that there's gonna be questions, I'm sure, that are gonna be more specific that Julie might be able to answer than I can.
No? Oh,
Give it a shot.
okay, I'll give it a shot. Can you hear me?
Can you hear online? Can you hear her online? Try.
Okay, I'll just start talking and hopefully, yes, it'll go. We did compare with other labs, and this is in line with their current charges. I mean, give or take, right? But it's very, very close. So it's with other public labs as well. You could go for testing, like submit your sample to, let's say, Madison directly, but the problem with that is the shipping and the handling, and that takes time. And if they don't receive it within a timely way, they can't test it. So we are providing a service to our community that can meet that need as well. So while there might be some discrepancies between labs, it's in line with other labs. If that helps.
Thank you.
if I could. Do you have a company that picks up these tests every day and takes?
Some we do on site here,
Okay.
and we run those tests daily. When we, like for instance, the coliform test, we do that on site here.
Okay.
Nitrates we do send out, metals we do send out. And we do, and you know, we keep them at temperature, we batch them and we send them out to another lab for testing, but we do follow up with them.
And having had done some water testing on our lakes and things that I'm involved with for committees. Outside of work, we've had 3 samples that were sent down to the state lab that were denied because they didn't get there timely. So that's one thing that we're able to avoid by using the process that we have here.
And that's a benefit here because of the time it would take. Now, if a homeowner wanted to take their specimen and drive 4 hours to deliver,
Mhm.
it might work, but we're under constraints with delivery.
Yes. When we had our business well drilling, we would send out anywhere from 5 to 10 tests a day down to the lab. I hate to tell you this, but back then we were charging $50,
Mhm.
and
Okay.
it was considered a bargain. So I don't think 35 is too much.
Okay. Any other questions on water? Otherwise, we'll move on.
The bottle replacement
Oh.
is a new fee. So to date, we haven't been charging, but that was
In addition.
recommended.
Mhm.
Yeah, that is an addition.
And that's really if people take water bottles, they don't do their samples, they lose them, and then they come back in for more. We're just trying to get our costs covered for that.
Good.
Reproductive health is staying the same. It's really the licensing fees where we're going to see the changes, and there's been so many changes even in what things are called along the way that pretty much we've redlined the majority of what was existent in here from the last time we did the fee changes, which was back in 2020. And now we have the fee schedules moving forward. And this is the new fee schedule. You will notice that there are some definite changes in the rec ed camps and the pools and water, along with retail food, and how things are all set up in what categories they are. They've changed with the states. So we've matched all that to the agent program and then put the pricing in there. The intention of making these adjustments in the fee schedule is to ensure that our costs are covered and the agent program is funding itself. So that is where that was established. We have 3 people working in the program, plus we have clerical support along the way. We did add that 3rd person in last year. We were able to do that without raising fees because we were able to get grant funding to hire new employees and bring them on and train them in. It's what's called workforce development grant. Thank you, Julie. And but that grant has run through, and so we needed to adjust the fees. The other intention is hoping that our fee adjustments will not have to be readjusted for 3 years. So we tried to take the cost of living expenses and manage that out over a 3-year period. We're hopeful that the fees can stay stable for 3 years.
Why 3 years?
Instead of coming back every year trying to make those jumps up incrementally, we just felt like just doing it for a 3-year period and then reevaluating and looking at it. Should our costs go up unexpectedly, we will bring the fee schedule back.
Okay.
But just kind of looking at that so that people aren't experiencing that fee change every single year.
Do you go to bars?
Only if they serve food. I'll pass this over to Julie now.
Yeah, so if they meet certain criteria, there are different levels for licensure. And yes, if they do serve food, and there are different categories to that, right?
Bring that up.
And you can go there. Some of these categories recently changed by the state. So when Julia had mentioned that the actual category changed, that was mid-September. We got notification that had gone through the state. So they were going to use that structure when we do our debt cap fee, or when we pay debt kept their feet.
Mhm.
So they were going to use that, so we were just in alignment with that. So there are different categories. So for instance, if they have frozen pizza or if they sell food that's prepackaged, you'll notice some of those lines say serving meals prepackaged, simple, moderate, complex. So depending on what criteria the business that's selling food meets, they go into one of those categories.
So that doesn't fall into like their liquor license or the
no.
bar establishment. This is a whole different, so the only bars that we would be in are bars that would be serving food.
Don't they all?
Well,
I don't know.
Not-
I'm
Not
not
necessarily.
necessarily.
If they only serve alcohol, they would not have a license through us in our environmental health program. Are there any questions about the fees or the increases or any discussion?
I don't see any.
Thank you.
So this, Lynn, we will need to approve and then move forward. Yes, so we will need a motion and to move this forward to the county board to be
Okay,
put into the final budget.
okay. Do I have a motion to,
Motion to approve the fee schedules.
and a second?
I'll second that.
Any discussion? Everybody in favor say yay.
Aye.
Anybody opposed? Same sign? Okay, passed.
Okay. I'm gonna get back onto the agenda here myself. Okay. So, adult long-term care. Carol has, put her report in. And I believe Carol is online. Carol, did you have anything additional that you wanted to add to the reports that has come up, or?
The only thing new that has come up is that the state is doing another kudos board, this time for the dementia care specialists. And that's going to be available, I believe it's the week of the 20th. And I believe I emailed that to you late today when I got it from the state, in case anybody would like to put a kudos out for our dementia care specialist.
And I can get that sent on to the board. Any questions for Carol? Okay, moving on to behavioral health then. Alicia has included her report. I believe she's on. Do you have anything additional that has come up, Alicia, that you would like to add?
No, nothing new has come up. Just the CLTS is seeing more and more kids come in. And I think with now coming towards the end of the, what would we be at? Quarter? I don't know, quarter semester. We're getting more referrals for that. So it's kind of taxing the two service and support coordinators that we have. We also, the state used to have bi-weekly meetings where we could ask questions, and now they've taken that away as well. We have to send all of our questions to a inbox, which can take 2 to 4 days to get answered. So that slows up the process of completing things when we need to get answers. We will be meeting with Taylor County. Our first meeting is December 5th, to try and start our own group to help each other out, because the state did take away that technical support. That was really helpful, because there's changes to the policy and procedure for the long-term support waiver program. I would say bi-weekly. I mean, they're constantly revising the manual, so it's hard to keep up with that. And sometimes, they'll say refer to the manual. Well, we all can read. It's not that we can't read the manual, it's we need interpretation of the manual, which they don't seem to want to put in writing. So we have to try and decipher that ourselves. So hopefully getting some of these other counties on board to have this meeting, and bounce some ideas off of them will help us, because it's just getting there. There's just more and more that we have to do for that program. And like I said, having 2 workers in there, it's getting to be too much. We should really have another person in there. So that would be I guess the biggest problem right now. No mental health providers, nobody applying for the job. So CCS can't really grow without having, the master's level clinicians. We've got 3 people on right now, currently doing assessments on 2 more, which will be farmed out to Northland Counseling. We have 1 provider over there who is going to take those 2 for psychotherapy. But other than that, that's all we have is Northland Counseling, 1 person over there right now. So that's it.
Any questions for Alicia?
Could you tell me what
Oh, it jumped off. Sorry.
Could you tell me what the CLTS program is?
I don't know if we have enough time in the meeting to do that, but it provides services to children. They have to be either have a physical disability, developmental disability, or severe emotional disability. They are screened, functionally eligible. One of the service and support coordinators has to gather information from any medical visits, school information, therapists. They do the assessment in the home, and then they complete a screen, and that determines their eligibility to be on the program. Then they work with one of the service and support coordinators to develop an ISP, which is similar to like a treatment plan, what they're going to work on. The program helps to pay for services and supplies, home modification, things that their medical assistance card does not cover. We're the payer of last resort. They will help with setting up appointments. Some of these kids are non-ambulatory, they're wheelchair bound, have feeding tubes, home modifications. We do a lot of the high cost home modifications. So they're working with engineers or architects on how they're going to build ramps upstairs, or they're going to have one of those tracks on top of the ceiling to with a lift, for a child that needs to be moved from the bedroom to the bathroom and lowered down into a special bathroom if they cannot walk. They attend school meetings for children on IEPs. There's a lot that they do. And the most recent change was, in addition to the functional screen, now the coordinators have to write up an assessment on top of it, which has 19 areas of domain that they have to fill in. So there's a great deal of paperwork. There's deadlines that we have to meet, just like in CCS, 30 days, 60 days, 90 days. It's a complicated program. It really is. Patty Desjardins helps us on the fiscal end of it, because there's offs that have to be approved. I really can't explain all of it in a matter of 5 minutes.
That answers my questions. I was just curious because there's 47 consumers, so
Yeah.
it's a big
It's a
department.
big department.
Thank you. That answers my question.
Okay,
Thank you, Alicia.
sure.
Also under behavioral health, we have Joe here, and he is going to come up and talk a little bit about mobile crisis, and other things.
I think you have the copy of the crisis contacts. Did that go out? Okay.
The one through June.
Through June.
Yep.
So I have a detailed report there of the crisis contacts for the first half of the year. Just a couple of highlights are that it was kind of interesting that the first 3 months of the year, there was a total of 47 crisis contacts. And for the next 3 months of the year, we had 47 crisis contacts. So it stayed pretty equal. I have some preliminary data on the next quarter, which ended in September. And that quarter, we have approximately 25 contacts. So it did go down, which would put us at 119 contacts to date. Generally, we have about 125 to 130 crisis contacts a year. So depending how the last quarter comes through, we may have more contacts this year than we had in the previous year. I don't know what that means. Maybe a lot of more there's more word out there on getting help, you know? I mean, October 10th was National Mental Health Day. And I didn't see it on a nice little chart there, but more
Thank
people are
you.
becoming aware, and I think there's more help. The other thing about the crisis calls are that, you know, some of them end up on holds. You can see on there's a key at the bottom there that tells you actually what happened, the number of consumers, whether it was the juveniles or adults or this or that. But we're at a pace to maybe be even. Well, I think we're going to be above last year, just to know that. The other thing I want to bring a highlight on is that in the past several months, we've moved several people out of Winnebago. Currently,
Thank you.
and I'll say that because I can knock on real wood. Okay, currently we have no one in Winnebago, which is a big step for us. I was able to find one placement at a facility, Brodelac facility, which is it's costing us approximately $9,800 a month, as opposed to the $42,000 a month in Winnebago. We have another individual that moved out of Trempealeau just today, and Trempealeau was costing us, you know, $12,000 a month, and we were able to move that person with our support of our CSP program through Northland into transitions. Okay, so that's a win-win situation when I can get somebody out of one of those programs into transitions and in the community. You know, and it's good for the person. They're back in their home. And they can get the services that they need through Northland. And then there was a juvenile that was placed in Winnebago for a while. Again, $42,000 a month. And ended up with Sarah here. YJ was able to get him placed in Lincoln Hills. It's not always the best placement, but the collaboration of all the professionals thought that was the best choice. So we're doing well with moving people. I have 3 people in transitions. It's licensed for 8, but there have been some real staff issues, and Northland has been aggressively looking for new staff in the light of Carol's passing, and to continue supporting us there. They hired 2 or 3 new people, and we're going to I haven't been really wanting to get too many people in there because of the fact that we only had 3 staff working 24 hours a day, 7 days a week. So you figure people are working a lot. Now we can move toward that, and we may look at marketing a couple of the beds back out to our other counties that have used us in the past, like Bayfield or Ashland. So I feel good about that. Feel good about, the getting people out of the facilities that are costing more money. My concern is the number of contacts, but that goes with the territory. I don't know if anybody has any questions. Yeah, it doesn't always work out as well as you like it.
I'm very impressed, Joe. Very, very impressed.
Well, it's a collaborative effort,
Yeah.
with using our CSP and other people there, to make that happen.
One you said was out of Winnebago and into.
A
Right.
Brodelac group home, yeah.
Yeah.
It's kind of a more structured facility to transitions, but it's costing us, it costs the county a little over $300 a day as opposed to $1,400 a day. That's huge,
Yeah.
And the hope
If
might be
they're
if that
getting
person,
more, Well,
The hope might be that person might be able to return to transitions, maybe at some point, but maybe not, I don't know yet.
I was just wondering about if they're being transferred to a facility that offers perhaps better treatment opportunities
Thank you.
from one that didn't have those treatment opportunities.
I think,
Why are they taking so much of our money and that when this one can do it at this amount of money?
well, I think sometimes it's a combination of the individuals have been stabilized with medications more, and maybe there are, they're not always better treatments, it's just different things for people. I mean, we do have some individuals that they do, as Dave Bauer always used to use the term ebb and flow. There is an ebb and flow to that population,
Oh, yeah.
and but we're in a good spot right now. The only issue we have, and we had a meeting with Julia and Andy spearheaded a meeting with the sheriff, our transportation costs, I mean, if somebody wanted to start a business to transport people, there's money there because, when you're spending $400-500 just to get somebody to come to Hayward to do a transport,
Mhm.
that's pretty expensive,
That's always been a problem.
That's a problem. But we're gonna look to, Andy had some creative ideas, I think, and we're gonna look.
And when I asked that question about high cost, lower cost, I
Right.
wasn't denigrating you or
No, no.
what this, I was kind of more irritated with the state.
Right,
So,
but it's a good thing, so I feel good about it.
thank you very
Okay.
much.
Joan, may I ask you, where's Broadlock at? I've heard of that before.
Portalock, they have like, half a dozen facilities. This one happens to be in the Eau Claire area, Chippewa
Okay,
Falls.
yeah.
They're,
So,
they're a group home for mental health. Fine.
yeah, our people are closer to home then.
Yeah.
That's good.
Thank you.
Thank you, Jill.
Well, that is good news.
Okay, moving on to Child Protective Services. I already did the announcement for Sarah, so she's just getting her feet wet. One of the things that I did want to make note of is we have had Season Westfall in as an interim supervisor that would be helping out with that programming. We're going to continue to keep her on during the transition. We obviously don't have a replacement for Sarah's job yet. So she needs some time to be able to train in. Season is available to stay on with us to help support us through that process. So we aren't just kind of leaving our team hanging and throwing Sarah into this without any support. So wanted to just make that known.
Excuse me, Gloria. Who was doing the search for her replacement? Carol's?
For Carol's, so Sarah's taking over the CPS supervisor. Are we talking about CPS?
Yeah, Child Protective
Yep,
Services.
yep.
Who's doing the search for
Sarah's replacement?
anybody's replacement?
Sarah took over the job as supervisor.
Okay.
And
I thought you said somebody else.
Season, we contracted services with somebody that's out of the county to be a part-time supervisor for us while after Carla left and we didn't have a supervisor. So, so we've had Season here that whole time.
Okay, I misunderstood you.
Okay.
Thank you.
And then the other thing, I'll try to have a better report to show over time what's been happening with children in care, but those expenses are going down. We are transitioning kids into permanency. So it is looking really good as far as that goes. So I'll try to make sure that Sarah and I can work on that together. So we'll have a report next month for that. And any questions related to Child Protective Services? Double checking on the board, I can see things here. Okay, so then we'll move into Youth Justice. And Sarah's report is in there. Sarah, you can come on up. We're also, you asked about truancy last month. And one of the things that we're working on is what does that look like as we move forward? Sarah is going to be able to present for us on this. Okay, I just need to get my share screen up. Oh. slideshow. Beginning. Okay, I think we're there. Oh, maybe. Okay.
So when we start talking about truancy, the next couple slides get into statutes and what it looks like and what it means. So if a student is absent without an acceptable excuse for all or part of one or more days during which school is held, they are considered truant under Wisconsin statute, section 118.16. Paren 1, Paren A, and okay. It's important to note, per Wisconsin statute, homeschooling that meets specific criteria may be substituted for attendance at a public or private school. Habitual truancy. This means if a student is absent without acceptable excuse for all or part of 5 or more days during a school semester, they meet the definition of a habitually truant. Schools may refer habitually truant students to juvenile court intake or municipal court only after satisfying the steps detailed in Wisconsin statutes. So this diagram, it looks at the school year of 2021 to 2022, and it looks at absence rates. So it says for Sawyer County in particular, 21.7% of all students enrolled in Sawyer County schools were chronically absent. This one, it looks at it looks at JIPS truancy referrals as percentage of all received referrals. So if you're not familiar with the term JIPS, it's juvenile in need of protection or services. And so when we get a truancy referral, it would more than likely fall under JIPS as it's not a delinquency concern. And so this shows the different counties in Wisconsin, and it's kind of, some counties choose not to really have a lot to do with truancy. And those are, I think, the boxes in white. They're a very minimal amount. However, I think when we look at Sawyer County and the needs of our county, it may look a little different than other counties. What I see is when we look at our families and the sometimes like historical pattern of generational poverty, I think we start looking at truancy as a beginning concerning factor that we should start to focus on. And so I think where a lot of other counties aren't focusing on this, it is a concern for Sawyer County, so that we can start to get out of some of this cycle that I think we've seen for a number of years. And I think that's where we start moving forward. This slide shows its youth justice intake recommendation for JIPS truancy referrals, and this is throughout the entire state of Wisconsin. So as you can see, across the board, more times than not, the case is closed at the time of intake. So that could be that counties are, maybe just recommending that they look at what the juvenile is struggling with. That could be family issues, it could be trauma, and maybe they just need therapy, somebody to talk to. And so they can recommend that without making it official and on any kind of order. So the next one down, it goes in different avenues that you can take when you get a referral sent to you. So a deferred prosecution agreement, that's saying that the family and the juvenile, along with a worker at the county, they're making an informal agreement to work on truancy concerns together. And then the formal petition is the amount of referrals that actually get sent on to court, to kind of rise to that higher level of holding a kid and a family accountable. So a status offense, truancy is considered a status offense, or an offense that, if committed by an adult, would not be considered a criminal offense. Research suggests the underlying needs of youth who commit status offenses are best met outside of the formal youth justice system. So what research has shown is that when you take these kids that they're not committing criminal offenses, but rather these JIPS cases, a juvenile in need of protection, rather than putting them in the system, it's better to try to meet their needs outside of that, because research shows that throwing them into the system can actually cause more harm than good, because now they're being put into that criminal system at an early age. The impact of absence from school. Research has demonstrated chronic absence, missing 10% or more of a school year for any reason, excused or unexcused, has a significant impact on a student's achievement. Students who regularly miss school are more likely to miss early learning milestones, less likely to graduate on time, more likely to drop out of school, more likely to experience poor outcomes in adulthood. Unexcused absences also impact communities as high rates of truancy have been found to be associated with higher rates of daytime criminal activity. This slide, I'll just kind of summarize it, but this gives different reasons for why a youth may not be going to school or may not want to go to school. So it could be problems in the community, problems in the school, within the family, or just that student having maybe unmet mental health needs. In working with these kiddos, whether they're on for criminal offenses or truancy, there's often their mental health plays a big part of that. And it could be that they have severe anxiety, or maybe they're being bullied at school, and there's all these different factors. That's a lot of factors up there that can really affect whether a kid wants to go to school or not. And so I think it's important for stakeholders to kind of come together and talk about these concerns and try to brainstorm and collaborate as to meeting their needs and helping them move forward in a positive manner. Truancy is complex. Research suggests youth may be chronically absent for multiple reasons, spanning several different categories as seen on the previous slide. The most effective approaches to truancy include families, schools, and communities working together to set and consistently enforce rules for attendance. Research shows truancy is a strong indicator of youth needs compared to future delinquent behavior. Punitive, harsh sanctions are more likely to increase the incidence of truancy. Matching services to identified needs is critical for long-term behavior changes. The most effective truancy reduction efforts are collaborative. There we are. So again, just talking about collaboration and working with stakeholders in the community, which there's one more slide, and that is where do we go from here? So this touches on, like I said, collaboration, and I think education is a large part of our community, and just having everyone understand, whether it be from the DPI website, so that they understand what kind of procedures the school needs to be taking, because I think a lot of stakeholders in the community look at the county as a solve-all for every problem that's going on. And I think it's important to educate that it's not always us that needs to fix the problem, and a lot of these problems can be fixed at the school level without it having to rise to higher levels. So we have also recently kind of designed what we call a truancy committee. And so it's Julia, myself, we have individuals, staff from the school, counselors, and we have our school resource officers who issue the citations right now as a start to this program and a start to collaborating on how to move forward in a way that's going to make a difference. Julie and I have also talked about the Sawyer County diversion program as a future possibility that we would like to hopefully start planning for and looking at different grants that maybe be able to assist having a worker in a diversion program, so that they can be more helpful in getting kids and families the resources they need before they reach that more criminal level. Any questions?
That was an excellent report. Thank you very much. I appreciate it because we had questions the other time, the other meeting. One thing I wondered about in Hayward, is there alternative to school?
There's really not a program per se. There is an alternative, like virtual option that I typically, if a kid is not able to be successful in school, or even if they get expelled, there is a program called St. Croix Central. It's a virtual program where they have still the one-on-one help from teachers that's in a school in Hammond in St. Croix County. And so that has been one option, but other than that, it's pretty scarce as to what our resources are for these kids.
Any other questions? We're working on things. We don't have necessarily answers for it all at this moment.
At what point do you get involved with the parents?
So I guess there's two different ways. Like for truancy, we are not involved at this point in truancy. We're hoping to work on that diversion program where we can be more involved and be more preventative in offering services and whatnot. However, if we talk about delinquency, the parents are involved at the point of intake. So the very first meeting that youth justice would have with a juvenile, it also involves their parents or guardian.
Thank you.
Okay, what point does it go from truancy to delinquency?
So a truancy would never go to delinquency. A delinquency is specifically like a crime that is committed or a law broken, and that's the difference. So truancy would typically be under a JIPS order.
That's right. Explain that. Thank
Mhm.
You're welcome.
Are you able to bring up the screen anymore? Or should I? Nope. Yep. Well, it's letting you do that one. Okay. Next up is economic support. Shauna is unable to be with us tonight, and she didn't have any additions to add. And moving on to public health, Julie included a report and she might have some additions for us.
I did want to highlight just a few things. In the written report, I did discuss our mass influenza vaccine clinics. A total of 116 students have been vaccinated through that program to date. There was some changes with COVID-19 and RSV reporting. Those took effect November 1st. We did notify our providers on that and have been communicating with them regarding the changes. The fentanyl awareness team has made over 2,200 individual contacts through their presentations, and over 770 individuals have been trained for Narcan. Since the writing of this report, we did receive the Narcan Direct program, and that is would supply 40 cases of Narcan to Sawyer County. So we're working on distribution with the Sheriff's Office on that as well in their festival. Also, I wanted to highlight Wisconsin Foundational Public Health Services Capacity and Cost Assessment. This was a program or an assessment that each local health department was invited to partake in. We used 2022 data and we used their assessment tool to look at our cost for public health, as well as our capacity to carry out the foundational areas and foundational capabilities. It's on the top of the report there. If you see public health foundational areas and capabilities, the assessment tool actually looked at each one of those individually and looked at how we implement those as a local health department. Over the last 2 days, we were looking, I attended a meeting held by WALDEB that discussed preliminary data for that. And so it's going to be finalized, the data, and then a report will be coming out likely next year on that. So just 92% of all Wisconsin local health departments did participate to submit data for that. So we're looking at it on the state level. Also, since this report was written, we did have a staff member, Joyce Knowlton, attend the Towns meeting and present on fentanyl, and there was really good response with that. Any other questions? Any questions?
No,
Good job.
thank you.
Okay, I don't see any hands up online, do you? Okay, and then Patty is just left for vacation as well. I did ask her if there was anything that she wanted me to point out in the fiscal report. There isn't anything outstanding. We are looking pretty good for our budget this year.
Any future agenda items?
Refugee? Yeah, yep. So, yep, do you want, well, we'll be talking about potential refugees. We're going to be meeting on that probably tomorrow, start discussing. Yes, yep, we can tie in with some homelessness warming shelter updates as well.
Okay.
Okay, we'll get that added. Anything else that anybody would like to hear about from us?
I guess not.
Okay.
We're adjourned. Pardon?
I see nothing online.
Oh, we're adjourned.
Okay, thank you.
Thank you.